Hey everybody, I am here with Sunny Strasburg. LMFT is certified and licensed psychedelic trauma therapist. You can find her at sunnystrasburgtherapy.com. So we're here to talk about mental health and some of the treatments she has available there at her practice. So Sunny, thanks so much for joining us today. I really appreciate it.
Hey, thank you. It's nice to see you.
Yeah, absolutely. And I wanted to start off just by asking how long you've been working with patients on their mental health.
I think I've been a therapist almost 20 years now. It's crazy.
Yeah, that's awesome.
Yeah.
Was there, anything in particular that really drew you towards that, made you want to, help those patients?
Yeah. So in my past life, I was a graphic designer and I worked at a video game company,
Mm,
several video game companies, and it just felt kind of empty. It didn't feel like it was really fulfilling
mhm.
and I didn't have a sense of purpose. So I left that and went back to school and got my graduate degree at Pacifica Graduate Institute, which focuses on depth psychology, so Jungian archetypal psychology, which dovetails beautifully with being an artist. So that was how I got started. And then I didn't realize how much I would love being a therapist,
Mm.
but that was like a total passion for me once I got into it.
Yeah, definitely. I can see that being a really rewarding field to be in.
Yeah, it's kind of funny how life is. Now I'm working at a company. One of my partnerships that I have, I'm working at Trip, which is a virtual reality company that develops meditation tools for virtual reality. And they just acquired a company that called Psychlediec that my partner David Starfire and I started creating playlists and meditation and therapy tools for people for mobile app. And so I'm the clinical director at Trip Psychlediec now. And it's kind of funny. It's like all of my worlds are merging together where we're developing psychedelic products for as a clinician for therapy practitioners. And it's in a video game format. So
No
it's kind
kidding.
of weird how everything kind of merges together.
Yeah,
Yeah.
that's incredible. And I wanted to find out from you, what do you feel like are some of the main concerns that, patients have that they're coming to see you for, that they're really looking to, get relief from?
Mm. Well, I mean, there are a lot of things, right? Anxiety, depression. I specialize in trauma. So PTSD, complex PTSD, attachment trauma. That's a lot of what I see in my practice. I'm doing more training now than clinical practice. So now I'm training other clinicians how to treat clients. And I specialize in psychedelic assisted psychotherapy. So I'm a trainer for that, and especially for ketamine therapy. And I treat patients with ketamine assisted therapy in my practice.
Okay. Yeah, that's fantastic. And over obviously the past 2 years, with it being so stressful for everybody with everything that's happened, do you have some good kind of tips and advice for how patients can stay mindful and really just feel like they're still in control of their life?
Yeah, I mean, I think it was Krishnamurti who said it's no measure of sanity to be sane in an insane culture, something like that.
Mhm.
And I think that we're really in a wild time, right? We have, climate change and the pandemic and, socioeconomic stress. And so we live in a stressful world. And since the pandemic, I'm seeing a huge increase in anxiety and depression and trauma.
Mhm.
And I've just been reading new studies about how COVID-19 can influence mental health, negatively impact mental health over time.
Mhm.
So, it's on the rise for sure. I don't think anybody doubts that. But, and then what's also happening is that there's a shortage of mental health practitioners. So I'm super passionate about getting access to clients for patients to get care. And by training clinicians, I feel like my biggest impact is helping clinicians be well trained so that they can help clients. Psychedelic therapy, all the new studies that are coming out are showing that it's very, very effective and you don't have to be on a daily drug forever.
Mhm.
And so I look at it like potentiating effectiveness in a shorter amount of time, right? It's not a fix all, it's not a panacea, but it helps potentiate our ability to really help people. And that's what I want to focus on doing. To answer your question more specifically, I think it's really important to get therapy if you can and see a therapist regularly. What I see a lot is that people wait until things are really bad to start seeing a therapist.
Mhm.
And if you can, I think it's kind of like always have your contact list, right? And have a therapist that you work with. And maybe you could see that therapist every month or every 2 months. And then if things start feeling more acute, you can see your therapist more regularly. I think that's a great, like having an established relationship with a therapist if you can. But there are all kinds of things that you can do to help your mental health. It's the basics. We all know these things, like eating healthy food, getting good sleep, getting exercise, being outside. Something that I think is super, super important is to feel like you belong to a tribe or a community. With the pandemic, the social isolation was really devastating for a lot of us.
Yeah.
And now that things are opening up, I'm so glad, because we really need human contact. We need other people, and hopefully, what we all learned from that is how important it is to be pro-social and to be with our people. It's not just being online. I mean, technology is beautiful. Look at how we're able to connect right now, Caleb. That's amazing.
Mhm.
But nothing replaces being with someone in person. A hug is really therapeutic.
Right.
You know, being with a friend and breathing together and talking together and having food together, and that's really, really important. So I think the first thing when you notice you're anxious or depressed, really check in with if you're socially isolating. And if you're doing that, I suggest that people really push out of that desire to isolate and connect with others.
Yeah, absolutely. I think that's a great point. Being in person with somebody and really being able to, experience that. Like you said, it's great having, technology and being able to
Yeah,
connect with so many people, but I think there's no substitute, like you're saying, for, actually being in person with someone else.
absolutely. I really noticed that being a therapist, because all of a sudden we were doing all virtual therapy, we had to. And I didn't realize how much I was able to connect with people just by watching, their foot tap. I can't see that on a Zoom call, or even if someone's anxious, and me just regulating my breathing and calming down, and just that creates almost like a habit field in the room where we're both breathing slower and deeper. So it's really powerful to be with people in person. I'm a
Yeah,
huge advocate.
yeah, definitely. And
Yeah.
so you mentioned that, ketamine is part of, what you do at your practice. Can you talk a little bit more about how that works?
Mhm. So I work with a nurse anesthetist who prescribes my medication for me and is with the clients. And I think what's really important to, from my point of view is um, to have proper preparation, and then the journey itself, and then integration. So how that works in my practice, I do a lot of therapy around the actual ketamine. Some people go to a ketamine clinic and they just get hooked up to an IV. They don't really talk to anybody, and then they just, go home.
Right.
But the way that I do it is really couched in the therapeutic container.
Mhm.
So since I work with trauma, it's really important to build rapport and to do some preparation work beforehand, right? Knowing what the landscape of trauma is, preparing the client for what to expect in the ketamine session. So we have several sessions before we actually have the ketamine medicine session. And then I offer lozenge ketamine, which is an oral administration, or an intramuscular injection of ketamine, which is a deeper experience. So we'll have the journey, which is 2 to 3 hours. My patients wear eye masks, and I have amazing playlists. I think that's one of my specialties, because I just sold this company. Psychlediec is creating really beautiful music for the journey, and it has meditations and my voice guidance throughout the journey to help people kind of stay in a safe, contained place while they're on the journey. And then as they emerge and come out, we do some integration work. We talk a little bit, and then we have therapy sessions after to help them make sense of their journey and how they can take what they experienced and apply it to their lives. And we'll do a sequence of 3 or 5 sessions spaced 1 week, 2 week, or 3 weeks apart, depending on people's schedules.
Mhm. Okay, definitely. And then after those treatments, do you typically look to do, maintenance treatments with that, or do you feel that, most patients are good with those?
It's hard to say. It's so individual with people's diagnosis and how much trauma they have. So I really like to curate individual treatment, protocols for each client that matches with their needs.
Mhm.
So we're just tracking it, as it goes. It's not a one size fits all at all.
Sure.
And ketamine is a very interesting medicine. It's different. I'm also trained in psilocybin and MDMA therapy, which are not legal yet. They're scheduled. They're only in studies. So if you're part of a study, you can have MDMA or psilocybin. But with ketamine, the most amazing thing about ketamine is it's very different at different doses. And so a good, well-trained practitioner can really curate their treatment protocols with different dosages. So some of the sessions I do are low dose, and we could do almost like a hypnotic talk therapy. I do internal family systems work often with low dose. At a medium dose, people kind of, they have their eye mask on and they kind of go on the journey, and then we talk after. So ketamine is really an amazing medicine because it's very different at different doses. And then the high dose is not something I do, but that's, when you get your wisdom teeth out. That's like a whole other thing.
Definitely. And do you find that, most patients are pretty open to it, or do they have any concerns as far as, side effects or anything like that?
Everybody's different, but it's so important to talk at length with your practitioner and your provider about, your medical history, what to expect, what the side effects are. Ketamine's extremely safe, relatively. It's a very safe medicine, but you need a licensed prescriber that can, provide Schedule 3. Ketamine is on Schedule 3 medicine. So, you want to be with someone who really knows what they're doing. We're in an interesting time because there's this whole explosion of interest in psychedelic therapy, right? And I don't think a lot of people are really educated about what to look for in a therapist, and a lot of people are doing underground work. And I'm really adamant about making sure that you have someone who's very safe, who's licensed, who has been trained extensively, not just a weekend workshop.
Right.
And then there's another component to psychedelic therapy. In really good training programs, practitioners are given experiences. So part of your training is actually receiving the medicine. MAPS MDMA therapy is that way, where the therapist receives MDMA to know what that experience is like. I work at the Ketamine Training Center. We train clinicians, therapists, psychologists, MDs. And part of that training is an experience where you actually have a ketamine journey. And so I really encourage anyone that's thinking about psychedelic therapy to ask their provider how experienced they are with the medicine, because it's a completely different experience than any other kind of therapy. It's not like taking Zoloft or, a benzo or something. It's a completely different thing. You're really opening your mind up to this other realm of consciousness. So educate yourself, be careful.
Yeah, I think a lot of patients have just gotten used to that idea that if you're going to have a medication for your mental health, you're going to have to take it every single day, pretty much the rest of your life. And, the idea that you can come in and, just have the treatments, do the therapy, and then, not have to continuously take it is probably pretty new to most people.
It's amazing. I hear that all the time. I have clients that'll come in and say, I've been taking, whatever SSRI forever, and I don't really, feel that different. And then we'll do a sequence of ketamine treatments and they feel completely changed. And they might come in every, 6 months and have a journey or have maintenance therapy. As I said earlier, you want to have a relationship with a therapist. So a lot of my clients will come in every once in a while just for a tune-up, just kind of check in. But it's a really different paradigm. When you look at things like MAPS going through the FDA and getting, having this medicine become approved and get rescheduled, we're thinking it's going to be 2023. The thing that's really amazing about it is it's combined with therapy. We haven't really seen drugs like that require therapy with them, right? So this is a really new thing. And practitioners are having to step outside of their comfort zone and not being a lone ranger anymore, but collaborating. You have therapists like I do, collaborating with MDs or nurse anesthetists or nurse practitioners, and being a team. You have a treatment team that helps you. And this is beautiful. This is a wonderful thing, because then you feel like there's a more holistic approach. It's mind, body, spirit medicine, right?
Yeah, absolutely. And I think that's a great point. And like you said, there's, I think a lot of clinics that, patients go into and they just get the ketamine therapy and then they're kind of just, sent on their way.
Yeah.
Um, and I think it's more of just an option to get therapy, but I think it does make the most sense to have a, licensed therapist who can really talk through what happened on those journeys.
Absolutely. One of the reasons that I developed this app, Psyassist,
Mhm.
is I was having all of these patients reaching out to me saying, I went to a ketamine clinic and all of this trauma was evoked, and I had no one to talk to. At the end of the session, they just wheeled me out to the Uber, and
Mhm.
I don't know what to do with what happened to me.
Yeah.
And so, in my mind, I don't think that's really good practice,
Mhm.
right? I think it's really important to have the ability to integrate what happened to you.
Mhm.
And sometimes in the session, people will be anxious and need someone there, and if you're right there with them, it's really comforting to know that you're being taken care of and someone's with you, you know. So that's really important. I'm a huge advocate of therapy combined with any kind of psychedelic medicine.
Yeah, absolutely. And do you typically, talk with the patients as they're going through it, or is it more of just, they're there, you're with them, and then they talk about it afterwards?
It depends on the dose, like I was saying earlier. On low dose sessions, it's called psychelledic dose. You can talk throughout. It's a really interesting process because, I worked with internal family systems. So I think of things in terms of parts of us, right? And imagine that in our daily life, we have these parts of us that are like protectors, right? That manage our lives and make us seem like we're normal and we're not freaking out inside, right? Or that keep us safe, right? And put up a barrier. With these low dose ketamine sessions, it kind of softens those protectors. So that adds an element of needing a therapist that knows how to work with that, because you don't want any backlash from those protector parts, right? But the ketamine can soften those protectors, and then we can get into some deeper parts of the psyche, more exiled parts, more vulnerable parts, and do some therapy and work around that. I also do EMDR. So, having the buzzers on their hands and talking gently about what they're experiencing, and you can talk throughout the session. Really amazing, really potent therapy. And then, when after 2 hours, your protectors come back online, right? They're coming back up, but you've had access to all these parts of your psyche that are more open. But at a higher dose with ketamine, you're out. You have the eye mask on. You're listening to music. Your body's really relaxed, but your mind is very active. And so at those doses, typically you're lying back and you're quiet. Sometimes people are not quiet and they're agitated, and that's why it's so important to have a therapist there. But generally, you're not talking for about 45 to 60 minutes of that journey.
Okay. And what do you typically look for when you're trying to, determine which is going to be the best fit for a particular patient with the lower dose or the higher dose?
It's so nuanced, Caleb. It's hard to really make a blanket statement about that. I had a patient who was used to doing super, super high doses. I think I have more of a feminine approach of like more is not necessarily better. Like I don't say give them more medicine. You just need a higher dose.
Yeah.
So this guy had huge doses, but he would just dissociate, and so we weren't getting any work done from his prior therapist.
Mhm.
So when he came to see me, I talked him into doing a low dose, and he was like, "Oh, we won't get anything done. I need big dose." He was a military guy, so he wanted to like go, go for it. And but the low dose was really amazing, and it opened up parts of him that he had completely blocked out of his mind. So I don't know. It's really curated for the individual and kind of looking at what their coping strategies are, what they might need. Some people that have a lot of control issues, sometimes through working and getting consent from those protector parts, it's really wonderful for them to have a deeper experience and have an ego dissolution experience, right? Where they are able to just let go of everything and not hold on so tight. But you have to be a good therapist to know if people are ready for that, right?
Yeah, absolutely. I think that's a great point. And
Yeah.
so you mentioned, in the beginning, talking about, patients not having to wait until, things are really, really bad in their lives.
Yeah.
What do you, typically recommend for like when should a patient start trying to get professional help? When do you think they should, really start reaching out and trying to find someone to help?
Well, as I said earlier, I think just having a therapist that you have an established relationship. So I definitely want to say that. But, if you start noticing that you're sleeping a lot, that you're withdrawing from people, I think social isolation is a really big clue. If you're changing your dietary habits, if you're not exercising, things that used to give you joy just feel empty. If you feel angry a lot, I mean, it's interesting because, we have different ways of coping. So some people are dissociated and distracted and can't focus. Some people, when they're depressed, get really angry,
Mm.
right? And they're like screaming at people while they're driving, So it's just kind of like watching these, just not feeling good, not feeling
Yeah.
good. And it's so important too to have to rule out any medical issues. Sometimes a lot of my patients are women that are in that age group where they're going through menopause or premenopause. And you really see changes in thyroid levels, for example, where you feel depressed and down and weight gain. And so you might think, oh, that's due to the depression, but it might be a physical thing, right? So when I work with women like that, I like to send them to get a workup with their medical provider, make sure they don't have, thyroid issues, hormone issues, or, pre-diabetes or things like that. It's just, it's, we know ourselves. We know when we're not quite right.
Right.
You know,
Mm.
I, everything that I work from is based on the idea. I believe people that we all have the answers inside of us,
Mhm.
and it gets all cluttered with stuff, trauma, and societal pressures and programming and all of that.
Right.
I trust the inherent wisdom of the psyche. I feel like if I call myself a midwife of the psyche. I feel like I'm just like creating space for
Yeah.
what wants to be born, right? And I really trust that people are inherently wise,
Mm.
and we know when something's off. Listen to yourself and pay attention to those clues,
Mhm.
and don't be afraid to reach out and ask for help. It's so, so important. And then I definitely want to say, if you ever feel like you're going to hurt yourself or someone else, to call the suicide hotline, the 988 number. That's so, so important. And just like a base level, like anytime you feel like you're going to hurt yourself, reach out, call the hotline.
Yeah, absolutely. And I think that's, a great point. Like you said, I think patients, excuse me, people know what they're looking for and what they need, but, it's really easy to get bogged down with, everything in society and technology and everything.
Yeah. Yeah. You know, I think we're so used to looking outside of ourselves, right? Like you said, technology and social media, scrolling in a way of just kind of checking out
Yeah.
and just spending a few minutes. I'm a real advocate of meditation.
Mhm.
I have a daily practice every morning, and just really sitting with yourself, even for 5 or 10 minutes, just like asking yourself, what's happening in my body,
Mhm.
right? Where do I notice things happening in my body? Do I feel a pit in my stomach? Do I feel clenched in my chest? Do I have a lump in my throat?
Mhm.
And really getting curious and asking that part, like, almost like it's a part of you, like lump in my throat.
Mhm.
What do I need to know? Like what's happening to me right now? Can you tell me what's going on?
Yeah.
And everything in our culture right now takes us outside of ourselves. And so I'm always trying to encourage people to turn inward, and because inside, you have wisdom inside.
Yeah, absolutely. And I wanted to find out from you, what would be the best way for patients to get in contact with you if they're, in the area, and want to, come see you for therapy?
Sure. I'm licensed in Utah and Maryland. My website is sunnystrasburgtherapy.com, SUNNYSTRASBURG therapy.com. And that's a great way to find me.
Okay, perfect. And then finally, do you have any, last advice for a patient that's maybe, struggling with their mental health and isn't really sure what their first kind of best step is?
Yeah, I mean, again, I think the suicide hotline is important if you're in a real distress,
Yeah.
or even if you're, thinking about harming yourself.
Mhm.
But yeah, there are all kinds of resources. Like Psychology Today has a great website where you can find practitioners in your area. EMDRIA.org, that's EMDRIA.org. You can find an EMDR practitioner. EMDR is amazing for trauma. The IFS Institute is a great resource for finding internal family systems therapists. And then I'm involved in a nonprofit organization that offers free online sharing groups of 6 to 8 people. So that's a free resource. That's indrasnetcoalition.org. that's a great resource for getting just in a group. It's not led by necessarily a licensed mental health practitioner. They're peer-led groups, but it's a way to connect with other people. So again, I think feeling like you belong to a community is really essential. So check out indrasnetcoalition.org. Yeah, so I guess those would be my recommendations.
Okay, definitely. Yeah, I appreciate you listing those and giving patients some options if they're not really sure where to turn is that first best step. But I think you definitely hit the nail on the head talking about finding a therapist you can have a relationship with and really just having somebody you can talk to ongoing.
Yeah, I think that's great. It's like everybody has like their main, physician, right? And you call them when you have an infection or something. Have a mental health practitioner that you can reach out to. I think that's a really good thing to do.
Yeah, absolutely. All right, great. Well, those were
Sounds
the questions I had for you today. So I really appreciate you taking the time to talk and share the education.
Yeah, it's great talking to you, Caleb. Thanks for having me.
Yeah, of course. Have a great rest of your day, Sunny.
Okay, you too.
Thanks.